Hello everyone and welcome to North Lincolnshire Clinical Commissioning Group's annual general meeting for the financial year 2020 to 2021. I'm Dr. Faisal Baig, I'm a local GP and I hold the immense privilege of being chair of what I see as one of the best CCGs in the country. And hopefully during the presentations today we will demonstrate to you why I think that's the case. Now, we would have liked to have held this AGM in person, like we have done in years gone by, but coronavirus is still very much here with us, and we do worry about spreading infections. And so a decision was taken to hold the AGM virtually again. So I do apologise to those of you who find it difficult to access the digital means or would have preferred an in-person meeting, but we've done it on safety grounds. So thank you for bearing with us. So the AGM really is an opportunity to reflect on a year in the CCG, and it's quite possible this will be the last year of CCGs existing in our country, last financial year. So it's an opportunity for us to really reflect wider on some of the work we've done as a CCG. And also an opportunity to look at the future and what the future NHS architecture and landscape holds for us. So in terms of the agenda, I'll be talking a little bit about our NHS challenges and opportunities going forward. Emma Latimer, our accountable officer, will be talking about system working and integrated care systems and what the future will look like. Alex Seal, our Chief Operating Officer, will be talking about place and performance and really reflecting on the work of the CCG. Emma Sainer, our Chief Finance Officer, will be talking about the finance, and if anyone can make finance interesting, it's Emma Sainer. Dr. Satpal Shekhawat, our Medical Director, and Helen Davis, our Director of Nursing and Quality, will be talking about North Lincolnshire's absolutely brilliant vaccination programme. We then have a highlights of the year video put together by our comms team, Mark Williams and Sophie Lidbetter, and a big thank you to Mark and Sophie for all the work they've done in putting together the AGM today. Erica Stoddart, our Vice Chair, will then be hosting a question and answer session, and that will then bring us to a close. Okay, so here is a collage. We recently had the Chief Executive of the NHS, Amanda Pritchard, come to North Lincolnshire, and Sophie and our comms team put these photos together. And I really wanted to bring them up today because they demonstrate some of the absolutely brilliant work that has taken place in North Lincolnshire and how people have come together, how the local NHS has come together, how we've been working with our council, how we've been working with our public, our patients, and many, many others. So I just see this as a really vibrant collage of some of our brilliant work. So please take a few seconds and have a look at some of those brilliant pictures. A big thank you to everyone. There are so many people to thank, so many teams to thank. What a year. Outstanding effort by absolutely everyone involved. I'll start with our local NHS, our frontline clinical teams, our non-clinical teams, everyone who's come together. I'd like to say a special thank you to all the managerial teams because they don't get mentioned much, but they do a hell of a lot of work behind the scenes that people don't always see. And a big special thank you to all the managerial and admin team in our CCG. A thank you to our public and patients for all your patience, for working with us in such a collaborative way. A big thank you to our volunteers, our carers, our key workers, and then so many partner organisations. I'd like to say a special thank you to Council Leader Rob Waltham and North Lincolnshire Council, to Dr. Peter Redding, Dr. Kate Wood, and all of the team at Northern Lincolnshire and Gould NHS Foundation Trust, to our MPs locally, Holly Mumby-Croft, Andrew Percy, to our primary care networks who represent our 19 general practices, their clinical directors who've worked so hard in terms of the vaccination programme, and SafeCare, our GP Federation. There are many, many others to thank, but really this is a big thank you to all of North Lincolnshire for coming together as a family and helping us deal with this pandemic. Unfortunately, across the UK, we've had over 130,000 deaths attributed to coronavirus, over 300 of those in North Lincolnshire. For every person we lose, unfortunately, there are loved ones who are affected forever, and they will be going through a difficult time still. So really, on behalf of our CCG, I'd like to offer my most sincere condolences to everyone who's lost someone. So I'm going to talk a little bit about some of the challenges that we are facing, and we are facing some really big challenges. Coronavirus is still very much present here in our communities. In the last 24-hour recording period in the UK, we've had over 34,000 cases. In North Lincolnshire, in the last 7-day recording period, the 18th to the 28th September, we've had over 1,000 cases. That's almost a double the England average in terms of the case rate per thousand. We have around 7,000 COVID hospital inpatients across the UK. So these are worrying times, and we need to protect our NHS. And the term protect the NHS in some respects has been taken out of context at times, thinking it's about protecting the staff and protecting the organisation. What it really means is protecting the public, because we need an NHS that's there to respond, not just to coronavirus, but to everything, to the day-to-day stuff, to other emergency care. And if we have an NHS that's inundated by coronavirus, it can't respond appropriately. So that's what protect the NHS means. And, you know, we need to keep these coronavirus infection numbers down. I take every opportunity I can to plug the messages about hands, face, space. For those small number of people who still haven't come forward for the vaccine, please come forward. And when people have symptoms, I would say please isolate and arrange a test. We had big challenges with hospital waiting lists going into the pandemic. Unfortunately, they've been exacerbated to quite a great degree. In July this year, we had over 5 million people across England on hospital waiting lists. That's nearly 1 in 10 of the population. That's a significant number. We've got some really huge amounts of work to do to address these waiting lists, and we need to look after people while they're on these lists. So, for example, we may have people who are in pain awaiting a hip or knee operation, and we're coming together as a healthcare community to make sure we do all we can to ensure those people are looked after while they're waiting. We have significant demand. In July this year, there were over 1,999 calls. That's the highest number on record. If we look at Scunthorpe General Hospital, our A&E department, July last year, we had around 5,500 attendances. In July this year, we've had nearly 7,000 attendances. That's a huge increase, and we're in the middle of summer in July. If we look at general practice, we've had almost 95,000 general practice appointments in June this year. That's over 20% more than the number we had 2 years ago. Over 2/3 of these appointments have been face-to-face. I could go on, mental health, our community services, but the point I'm trying to make is we have a situation with regards to the demand, and we really need to come together to address some of this. Health inequalities have been mentioned a lot, and they really need to be at the heart of everything we do as we move forward. We know that certain parts of our population, certain groups, are disproportionately affected by not only coronavirus, COVID-19, but by other health conditions. And, you know, populations that have been highlighted are deprived groups, so areas of deprivation, people of certain race and ethnicity, people with learning disabilities. We know that a recent study by Oxford University and partners found that people with learning disabilities are actually 8 times more likely to die of coronavirus. That's a really worrying figure. So we really need to put health inequalities at the heart of everything we do going forward. Now, in terms of addressing these challenges, we can only address them with a workforce. We have a workforce that's emotionally and physically very tired because of the pandemic and because of the recovery work that we're doing. The BMA, the British Medical Association, estimated recently that we have a shortage of approximately 50,000 doctors in the country. That's significant. The number of nurses, not far off in terms of estimates. Couple that with how tired and exhausted our workforce is, we really need to look after them. We need to support them. It's a difficult time, and we need to treat our workforce with patience and support them. I've mentioned NHS reorganisation here. It's a challenge and an opportunity. I'll talk a little about the opportunities in a while. But in terms of the challenge, while addressing all of these issues we have, obviously, in terms of a big reorganisation, that requires capacity, time, expertise, and our teams are, trying to come together to make sure this reorganisation works well and it's the right one. But obviously, that's taking people out of day-to-day care, so we need to be mindful of that. With challenges come lots of opportunities, and I think we need to be positive about the future. There's been some absolutely brilliant work done in terms of our relationships and partnerships during the pandemic. And much of that's been really about breaking down organisational barriers. The vaccine programme is a brilliant example. For example, how we've come together as a local NHS, our council partners, volunteers, and many others, have cut out so much of the red tape. And we've just looked at it in a very straightforward way. There's a patient, we need to do the best by the patient. How do we do that? And we've managed to do it. So we need to make sure we don't go backwards in terms of that bureaucracy, but we move forwards and say, actually, the patient's at the heart of everything we do, and the rest is all secondary. So lots of opportunity there. In terms of innovation, there's been some brilliant work that's been done. Virtual consultations have been a part of the NHS long-term plan for quite some time, and the pandemic has accelerated some of those consultations, for example, video consultations and online consultations, and I think it's fair to say they've carried some controversy as well, but the reality is, as a clinician, as someone who sees patients regularly, face-to-face clinical appointments, where clinically appropriate, should absolutely be taking place, and they are, whether that's in general practice, in hospitals, or in other services, or where people can't access digital means, they should take place. But actually, video consultations, telephone consultations, and online consultations have a big role to play. And we get a lot of feedback from patients saying, "Doctor, thank you so much. I'm at work. I didn't have to take the day off. You rang me here." Or, "I'm looking after the children. I didn't have to come out with them all." So we need to build on some of the positive momentum there, whilst realising that there is absolutely a strong place for face-to-face appointments still, and no one should think this is about replacing one for the other. This is about having a hybrid system that suits everyone as we move forward. Our medical director led a programme in terms of virtual pulmonary rehabilitation. And when these services were closed during the pandemic, in North Lincolnshire they were running because people were able to access them by wearing a headset at home. Again, a brilliant example we need to build on. So there's so much stuff we have done during the pandemic that we just really need to build on, and will see us in good stead going forward. Now, funding, something that always carries a bit of controversy with it, and I'm sure some of you will say, shouldn't that be in challenges? But what I would say is, whilst there's obviously arguments regarding what the government level of funding should be into the NHS, the reality is there has been a significant injection of funding for the next few years, and I think the challenge to us is how we use that and make sure we make the best of that. There's a real opportunity with regards to prevention. We've talked a lot over the years about things like addressing smoking, healthier lifestyles, healthier diets, working with our public health teams, but we really have come together a lot closer during the pandemic. And in terms of our public health teams and local NHS and council, we really need to build on that, because we want to ensure people start well, they live well, and we don't have as many of these health concerns because we're addressing the right things. And it's the same for things like education, income, employment, housing. There are many studies that indicate that actually these are probably more important in terms of having a healthier population than the quality of healthcare services. And that brings me to NHS reorganisation, which I mentioned in challenges, but actually a really big opportunity. This is all about bringing people together and addressing these things and working together across sectors and really cutting out all of the competition we've had over the past few years and looking at a much more collaborative kind of approach. So in order for this to work, we need everyone's support, we need everyone to come together, including the public, and I'm sure we will make it an absolute success if we have all of you behind us. So that's all from me. I'm now going to hand over to our Accountable Officer, Emma Latimer, who's going to talk a little about system working. Thank you.
So, good evening everyone, I'm Emma Latimer, I'm the Accountable Officer for North Lincolnshire Clinical Commissioning Group. I've been here since 2017 and I've seen this organisation flourish over the last couple of years with lots of new leadership at its helm. So I feel very lucky to be here tonight and telling you a little bit about what's going to happen alongside the rest of my colleagues. So the first thing I want to say, just echoing what our chair has just said, is a massive thank you to all NHS staff and to other key workers. In the 32 years I've been in the NHS, I have never experienced anything like this. The way that people have worked together, the pace at which people have worked and moved, and the way that we've worked together in a way that I've never seen before. People being kind to each other, supporting each other, and doing the right thing for others who are less fortunate than some of us. So I want to say a big thank you to them, to teachers, to police, to our local authority colleagues. There's going to be so many people I've missed out, but generally to everybody in this country for what they've done supporting us through this pandemic. And it's still here, and the support still needs to carry on. What I would say, though, is throughout that period, our local NHS has still managed to deliver a high standard of healthcare in an extremely challenging period. You heard from our chair the pressure that's been on the system in terms of the primary care demand, people turning up at our accident and emergency department, mental health services. So whilst we've been dealing with the pandemic, we've still managed to deliver lots of routine healthcare. We've also delivered over 1 million vaccines across Humber Coast and Vale, which is significant. And I have to pay testament to my general practice colleagues, without whom and their teams we probably wouldn't be here. So I want to say a really big thank you to them. It was also great to see that the NHS was awarded the George Cross, again, testament to the challenges that we face and how we've overcome them. And I also wanted to say a great big thank you to our community and voluntary support across the Humber area, and particularly in North Lincolnshire, who have stood there in all weathers, helping some of our most frail and vulnerable to access that vaccination. So again, a big thank you to you too. So in terms of our system challenges, and again, I know our chair's already spoken about these, but in terms of the recovery of services, I think the waiting list now, as Faisal outlined, are probably some of the highest I've seen in the last 10 years. So we've got a huge challenge ahead of us. We need to look after people and make sure they're safe while they're waiting for that treatment. And we need to work across the system to manage those patients. So although you may be on a hospital waiting list, you're actually a patient that belongs to the system. And we're working together to try and to make sure that you are safe whilst you're waiting for that treatment. And I think we're working harder and better than ever across all of the different agencies that work in health and care to make sure we do look after you. There are a number of pressures around urgent care. We've already talked about that in general practice. These aren't going away. And as we head into winter, the worry is they're going to get worse. So we need to use that scarce resource in the NHS when we absolutely need it. As Dr. Begg said, there are other alternatives, 111. There's pharmacies. There are other things you can do if you're in doubt of what you need before you go into ED or into general practice. There are lots of options for you. So we do ask you really to prioritise where you go to make sure that service is there for the people who absolutely need it as we head towards winter. And in terms of workforce, recruitment, retention, next generation, well, that's something we're really keen on. We're really keen on growing our own talent in North Lincolnshire. And our clinical directors do a lot of work, trying to encourage people to come and work here. It's a fantastic place to work and live. And we're also doing work with schools and colleges, trying to attract people into our profession because it's a wonderful place to work, although it is stressful at times. And as we've talked about before, tackling health inequalities, levelling up, we know for a fact that healthy people usually have a job, they have skills, they live in a nice house, they've got friends. We need to ensure that people get the same opportunity. Talent is evenly distributed in this country, but opportunity is not. So we really need to work alongside our partners to ensure that everybody gets the same opportunities in life. And that's why the system working that I'm talking about will help that. So, from the 1st of April 2022, the Humber Coast and Vale Integrated Care System, the ICS, which will serve 1.7 million people, will come into being. That's obviously subject to the health bill going through, which is currently has been read a couple of times. That will replace existing CCGs, and at the moment there are 6 CCGs in this patch: East Riding, North Yorkshire, the Vale of York, North Lincolnshire, Hull, and North East Lincolnshire. And what this will really see is the NHS and local government as equal partners. It's probably the thing that I've been wanting more in my career than anything, because actually, if we don't see local authorities as an equal partner, we can't address those wider determinants that I mentioned earlier around skills, jobs, education, employment, housing. They're so important to people's health, as important or more important even than access to healthcare. So this gives us a real opportunity to work much more integrated alongside our partners. We also need strong clinical and professional leadership. We've got that. You've seen Dr. Baig at the start of this. We need to hang on to that. So in previous reorganisations, we often lose lots of the good. We can't lose this. We can't lose the seat that our clinicians have had around our governing body table. They are the eyes and ears of the CCG. They have been. They tell us when things are going right, they tell us when things aren't going right. We listen, we learn, and we use that information to commission things and to buy services in the future. So as we move into our new health and care system, it is absolutely vital that we retain that local clinical leadership through medical leaders and other professional leaders. So in terms of what will happen, we'll have local delivery through 6 place-based partnerships. So we'll have a place-based arrangement in North Lincolnshire, which one of my colleagues will talk to you about, Alex, when she comes. But really, it's a real opportunity to look at the resource we get, one pot of money, one workforce. How do we best spend it to ensure that people don't fall through the gaps, and that we really reduce the number of handoffs between one organisation to another. So this is very much around person first, system first, and organisation second or third, whichever order you want to put them in. We also need to ensure that we get alongside our communities. You know, we are very much connected to our place in the CCG. You know, we work alongside people in our community. We listen to what they say. We need to ensure that is strengthened. There are different issues in the whole of North Lincolnshire. So Scunthorpe might have different issues to Barton, but we need to ensure that every single bit of our system is represented through that better engagement with people in our communities. So I talked about the 6 places. They are determined by local government boundaries. The ICS will operate within 2 geographical partnerships: the Humber, which is obviously Hull, East Riding, North Lincolnshire and North East Lincolnshire, and North Yorkshire and York, North Yorkshire and York. Obviously, it will reflect our local differences. There are very different issues in North Yorkshire as there are in North Lincolnshire, but there are issues around urban and rural areas and what we need to do to support people. And of course, it reflects the patient flows in our 3 hospitals. So it's North Lincolnshire and Goole, Hull, and also York Teaching Hospitals Trust. And again, we need to ensure that those organisations, without the competition that previously existed, start to work much more collaboratively together, making sure there's mutual aid. We don't see variation in one part of the system towards another. We start to level up there as well. So again, our place, this is going to be so important. As I said, you know, being connected to your community, the power of partnership can't be underestimated. Where things go well, it's where we all work together. We all believe in what we do and we have mutual accountability and purpose. And our partnership will involve primary care networks, our local authority, including public health, our providers of acute community mental health services, and representatives of people who access our care and support. And as I said, we can't underestimate that place arrangement and how pivotal it will be in the future. And before I hand over to the next slide, talk about timescales, I just want to mention Denise Hyde. So Denise Hyde was the local authority chief executive of North Lincolnshire Council, and she retired about a month ago. And I have to say, Denise Hyde has been instrumental in working with us and really putting our place arrangements where they should be. And we've had massive support from her. So I'm not sure whether she'll be watching this, but we all want to say thank you to you, Denise, and I hope you're enjoying your retirement. So in terms of timescales, so we've got development sessions, so we're doing a lot of development now around what the future may look like, and we're testing those arrangements as we move into towards March 22. We'll start to operate in April 22 and start to see the system mature next autumn. But what I would say to people is whatever reorganisation takes place, whatever system and governance comes into being, we will not forget the patients in North Lincolnshire. They will be front and centre of all our minds. This guidance, this new reorganisation should help us work better together and improve the lives for our patients. And whatever happens, we will make sure that you are always front and centre of what we do. So now I will hand over to Alex Seal, who's going to talk to us about our place challenges and achievements, and Alex is the Chief Operating Officer of the CCG. Thank you.
Hi and good evening everybody. I'm Alex Seal, Chief Operating Officer for North Lincolnshire CCG, and today I'd like to talk to you about our place challenges and achievements. But first I'd like to just introduce the Clinical Commissioning Group and what Clinical Commissioning Groups do. So Clinical Commissioning Groups were created following the Health and Social Care Act in 2012 and replaced primary care trusts on April 1st, 2013. They are clinically led statutory NHS bodies responsible for the planning and commissioning, that's buying, of healthcare services in their local area. CCG is a membership body, clinically led with GP practices as their members, and they're led by an elected governing body made up of GPs, other clinicians, including a nurse and secondary care, doctor, and lay members. CCGs are responsible for commissioning healthcare, including mental health services, urgent and emergency care, electives, so that means planned care such as operations and outpatients, and community care for our population. And commissioning is about getting the best possible health outcomes for the local population. So understanding what our local needs are, deciding what our key priorities are and strategies and plans for how we'll try to address those, and then buying those services on behalf of the population. CCGs are accountable to the Secretary of State for Health and Social Care through NHS England. So we are North Lincolnshire CCG, and we are responsible for commissioning the services within our area. So if you're registered with NHS Lincolnshire North Lincolnshire GP practice, we commission most of your healthcare. Our ambition is to help people to live healthier lives and make sure that when people do require health treatment, they receive the best possible standard of care. Our membership consists of 19 GP practices, and the number of patients registered with our GP practices is around 179,000. So I'd like to spend a bit of time now just talking about what some of our key challenges are in North Lincolnshire. And I'd like to start by talking about urgent and emergency care. So our local hospital, Scunthorpe General Hospital's emergency department, has been very busy throughout the pandemic. In the first two phases of the pandemic, we saw a significant increase in people with COVID-19 admitted into the hospital, some seriously ill people that needed to be supported within the hospital as well, which put significant pressures on our health services as well. Since the pandemic, we've also seen more complex people being admitted into our hospital as well, so the challenge does continue. An additional pressure for our hospitals is around having to implement our social distancing guidance and infection prevention and control measures. So this impacts on the space that's available to deliver the care that's available to our population. And also, of course, people are having to wear protective equipment as well. So that makes the challenge for our local hospitals a real pressure. We're still, however, seeing a number of people who could be seen quicker and by the right health professional as well. So we want to encourage people to talk before you walk. So if you're not sure where to go to get the care that you need, we would encourage people to phone NHS 111. They have trained call operators who can direct you to the right services that you need to meet your health needs. There's also 111 online as well, who can similarly direct you as well. Pharmacists are highly trained health professionals who can offer advice on medication, but also advice on minor conditions as well. Primary care obviously are a huge source of support and advice across our CCG as well, with GPs, but also a whole range of other professionals that can meet people's needs as well. And also the NHS app, which you can download, is a really helpful tool which enables you to order your repeat prescriptions, to book GP appointments, and also to look at your primary care record as well. The second area of challenge that I'd like to talk about is planned care. So this is outpatient appointments and operations. Due to the COVID-19 pandemic, there was a focus on discharging patients from hospital to make sure we had the capacity in hospitals to support people. And also at the beginning of the pandemic, stopping planned care as well to make sure that capacity and workforce was able to respond to the surge in people needing hospital treatment for COVID-19. This has led to an increase in waiting lists for routine services as well, with pressure for the hospitals. We're also, just to reassure, in terms of making sure we're keeping everybody safe, because of those increased waiting lists, those are regularly clinically assessed within the hospital to make sure that people are being kept safe on those waiting lists as well. We've also been working with providers and the independent sector to maximise the amount of capacity that's available to treat people on waiting lists as well, to make sure that we can really start to tackle that as well. And I would like to thank providers for working tirelessly on this as progress is being made in this area. The third area that I'd like to mention is around how we continue to support care in our local community as well. Throughout the pandemic, there's been continued provision of essential community services as well to make sure that we can support people and provide the right care for people. Just as an example, in terms of things like infection prevention control support, and we've provided advice and guidance and training to care homes working with our partners in the local authority. There's 100% compliance across our care homes by the end of July 2020, with more than 2,000 care home and domiciliary staff trained. Our GP surgeries are working harder than ever before and seeing more patients than before the pandemic. As Faisal said, there's now the tools to see people remotely and by telephone as well. And this has proved really flexible and convenient for people, so provided real support and help through this time of challenge. But also to reassure as well that people can see face-to-face when they need to do that as well. So that does help to manage some of that demand and pressure, but make sure we can be really flexible to meet people's needs. We're also working on how we communicate with our public across North Lincolnshire to make sure that they understand how best to access services and how best to access primary care. We also have a range of other professionals who are also working in primary care as well as GPs. So physiotherapists, pharmacists, nurses and social prescribers are just some of the key professionals that you can see within primary care to help you meet your needs. Mental health services have seen significant pressures through the pandemic period and continue to be, again, experiencing pressure as well. This has been very much exacerbated by issues such as social isolation and national lockdowns, which have impacted on people's mental health and well-being. And similarly, residents are also seeking different types of mental health services since they received before the pandemic. So we're very much looking at how we support that need and try to do lots of preventative work to support people through that as well. For those of our mental health patients who have the most serious conditions, who do require a mental health bed, bed capacity does still remain a challenge across our local area, but also nationally as well. And our providers of mental health services continue to do an excellent job working with colleagues and across the wider footprint to make sure that we can source the support that we need for our population. We've also been doing lots in terms of developing new services in mental health as well, including our primary care mental health teams. Looking at how we develop pathways for neurodiversity, so this is conditions such as ADHD and autism, and how we support people, and also improving our approaches to people who have mental health crises, and to make sure that we're able to prevent those mental health crises. Looking into the future, and looking into indeed a challenging winter ahead, we're planning for winter pressures, whilst making sure that we continue to deliver the recovery and planned care that I talked about. So continuing to tackle the waiting lists So that does present a real challenge for the NHS as well. We have really good plans to look at how we do that. And again, I would encourage people to continue to take up on the COVID vaccination, but also, of course, the flu vaccination as well, so that we can try and support some of those pressures into the winter. A key priority for us as well is the health and well-being of our health and care workforce, who have worked tirelessly through the pandemic and done a fantastic job to support through that period. We're also looking very hard to make sure that we're supporting the emerging health needs of people who didn't seek health during the COVID pandemic period, which can mean sometimes that more complex people are presenting for treatment now and into the future. So we're working very hard with our partners to make sure we identify and support those people to make sure that they access the care that they need. And then looking ahead, some of the long-term impacts of COVID, what that's had in terms of people's mental health, well-being, some of the wider impacts of the COVID health pandemic and on our wider society as well. So working very closely with our partners to make sure that we can look to tackle some of those issues in the future. We're very lucky to have thriving partnerships at place. And I just wanted on this slide to just identify some of the key partners that are working with us in our local place. As Emma's identified, our local place partnerships are absolutely critical to delivering our ambition for how place partnerships can improve outcomes for our population and look at addressing health inequalities as well. I also want to say a huge thank you to all our partners who have been critical in helping us to work together through the pandemic. And I think the strength of the partnership in North Lincolnshire has been absolutely instrumental to what we've been able to manage to achieve through this period of time. Also, I'm delighted to say that we achieved a good rating in November 2020 for the CCG. So all CCGs in England are evaluated each year for leadership, financial performance, planning and patient and public involvement. North Lincolnshire achieved a good rating from the NHS Oversight Framework for the first time in November 2020, and that represents huge progress as well. This was followed up by a positive narrative rating this year, so continued huge, excellent progress for our organisation and working very closely with our partners. So I'd like to take this opportunity to sincerely thank all staff and stakeholders for their hard work and hugely valued support in helping us to achieve this. In the final section of my presentation, I would like to touch on some of our key achievements as well. And you'll see more of this later on in our video of key achievements for what we've achieved with the CCG and our partners in our local place. The first thing that I would like to talk about is some of the support around mental health. So I mentioned the mental health challenge, and we've launched a free online mental health support service to help children and young people in North Lincolnshire. So this is something that people can access and provide support and counselling for children and young people. We also have similar support available across the population for the mental health needs as well, for adults as well. And I think that's been a really valuable service through this period of time. Over the last year, we've made excellent progress in looking at end-of-life care, with a number of innovations that have really helped to support more joined-up care and support for people at the end-of-life period as well. A couple of examples of that are our RESPECT programme. So this is a recommended summary plan for emergency care and treatment. And this enables people to have more say about how they would like to be supported within the last days of their life as well, and what choices they would like to make at that period of time. Similarly, our electronic palliative care coordination system, again, is an innovation which has been shared nationally as good practice. And this is a system which means we have really joined up communication between the many teams that are supporting people at end of life as well. So it has really helped to make sure that those teams can work collectively to support people's needs. The CCG was named a regional winner in the NHS Parliamentary Awards for its virtual reality pulmonary rehabilitation work. So an excellent example of innovation locally that's really helped to support people through the pandemic period by making available this additional technology for virtual support. Our community response team is a multidisciplinary team which is able to respond to people's needs in the community. Again, another excellent example of innovation which was recognised and shortlisted for the Health Service Journal Awards. We've also seen the establishment of a new medicine service in North Lincolnshire, which is a free medicines advice service provided by pharmacists and was introduced across North Lincolnshire within the last year. If you prescribed a medicine to treat a long-term condition for the first time, you'll be able to get extra help and advice about your medicine from your local pharmacist through a free scheme called the New Medicine Service. Again, residents in North Lincolnshire who have minor illnesses or ailments can now speak directly to a community pharmacy to receive support about this, and that's available online at northlinkspharmacies.nhs.uk. You'll be hearing more later on in the presentation about our very successful COVID-19 vaccination programme. And finally, I just wanted to highlight some of our digital achievements as well. Currently, all North Lincolnshire practices and our 2 local acute trusts are working together and are now part of the Yorkshire and Humber Care Record. This means that a patient's healthcare record can be shared across multiple providers, which enables much more integrated, joined-up care. Again, to help people get support about where best to access their services, for those people who contact NHS 111, they're now able to book an appointment directly with a GP practice if they're triaged as requiring a health professional. And finally, video consultations have been a really key innovation over the last year, which has helped to support people through the pandemic. That means that people can have a consultation from a healthcare professional from their chosen location, whether that's at home, out and about, reducing the need for travel, increasing the flexibility, and really enabling people to get better access to care. This is, of course, alongside the fact that people still are very much able to see people face-to-face where they need to do that. And we're also doing extensive work to make sure that if people don't have access to digital advice, that they're not excluded from being able to receive that care remotely. Finally, I'd like to commend you to our annual report, which is available on www.northlincolnshireccg.nhs.uk publications. I'd now like to hand you over to Emma Sainer, our Chief Finance Officer, who's going to talk about our financial performance.
Good evening. My name's Emma Sainer and I'm the Chief Finance Officer for North Lincolnshire CCG. And I've got a huge pleasure in taking you through what's actually the statutory part of the AGM this evening. As we've heard already, it's been an incredibly difficult time for everyone, and the pandemic has affected everyone in different ways, and NHS Finance is no different in that regard. Just prior to the financial year starting, the usual financial regime that we operate within was suspended completely, and we were mandated to ensure that we flowed as much cash as quickly as possible into the front line to ensure that vital services continue to be able to be delivered, again, as we've heard already this evening. And to some extent, therefore, you would expect that the finance agenda has taken, or did take during that period, a bit of a back seat. And to be honest, make no apologies for that, because actually that was the right thing to do. Protecting frontline services under the circumstances that we were operating within was absolutely the priority and the right thing to do. But what I would say is the volume of work that happened in the background, certainly with the team that I have the pleasure of leading, the volume of work didn't go away. The pressure that those guys were under in terms of taking forward and making sure we were supporting the front line was immense. And I would like to start by saying a huge thank you to my team personally for their resilience, their flexibility, their humour in what was incredibly difficult times. This evening I'm going to go through a few areas. Firstly, I'll take you through the financial performance of the year. I'm then going to do a little bit about where the money's gone, and I've taken the challenge of, again, keeping with making the money exciting, so I'll do my very, very best. And then I'm going to go through a little bit about what matters to me specifically. So, in terms of our targets, the CCG, as we've heard already, has got some specific statutory targets that we are mandated to achieve. And I have to say, I'm really, really pleased to say, for another year running, despite all of the challenges, we've risen to that challenge. Delivering in-year break-even, and again, you know, those of you who have heard me speak before, it isn't the finance team that spend the money. So this is absolutely down to the wider organisation and our partner organisations that we work with in order to deliver these financial targets. So pleased to say that we did deliver a break-even for the year. Running costs, keeping the management and bureaucracy to an absolute minimum, again, is something that is really important, and I'm pleased to say that we've achieved that target. Again, we've come in quite a bit under what we were allowed to spend as set by NHS England. Again, something I'm particularly keen to ensure happens now and going forward. Again, paying bills during this period was never more important to get cash flowing into the economy. I'm particularly keen to make sure that cash flows into our non-NHS suppliers. We do have a responsibility as an NHS organisation to make sure that we achieve those targets, and again, really pleased to say that we've done that with a clean bill of health for the year. And finally, you know, the overview and scrutiny of the accounts through the external audit process is something that happens every year. It is quite a rigorous process, and pleased to say that we were given a clean bill of health for the year in terms of what we were reporting, but also, most importantly for me, or maybe as importantly I should say, is delivering the value for money conclusion within the audit process. Again, the challenges for our external and internal auditors was immense. We were operating very, you know, remote working in terms of how we were delivering the audit. And again, they didn't, you know, they don't be under any illusions. They were very, very rigorous, but they undertook their work with real sort of flexibility and pragmatism wherever possible. So a huge thank you to them. So in terms of where we spend our money, so this is just a picture of where the money goes, and obviously, as you've heard others speak, particularly Alex, the vast majority of our allocation and our expenditure currently is expended within the hospital setting. That's both within the NHS and within the independent sector. Again, that it is the most specialist and most expensive end of the care that the NHS provides, and hence why the proportion is so large. But what you can see there is a sort of an outlook of where the rest of the money goes, and certainly I'll come on to in a minute, you know, my aspirations for the future as we move into the new way of working for the profile of what that expenditure looks like. But yeah, not insignificant, with just short of 300 million been expended within North Lincolnshire. So in terms of what matters to me, I'm a huge believer in that the finance community are here to support and enable everything you've heard described with my colleagues this evening. We're not here just to count the pounds and the pennies and stop people acting. We are here to spot opportunities to make a difference and find different and more effective ways of using what we've got at our disposal. You would expect me to say strong control over public money is something that I feel very, very passionately about. I do believe we're one NHS, and you know, again, you've heard, you know, the partner organisations within the NHS, there are many, but actually we are one NHS. we have one pot of money, as Emma Latimer said, we have one workforce, and it's how we use that to best effect. You can see there just some descriptions around some of the key things that we're looking at trying to do in terms of moving resources from some of that specialist end of the expensive end of our provision to being closer to home within primary, community and local authority-led services, because actually we have got an ageing population, we have got a population with significant long-term conditions that need a different response than necessarily just a hospital stay or hospital admission. And so those top two sort of bullets is trying to describe our ambitions around that. Tackling health inequalities, again, a huge issue. We are not all the same. Across the country, there are different health needs and health experiences, and actually being able to spot those and identify them and then put mitigations and investment into those areas is really, really important, and hence why I'm so passionate about making sure that we do the best with what we've got and make it as efficient as we can, because it frees up resources to target health inequalities. And again, that's really important to me. My final slide then is a little bit along that same theme. So the ICS, or the emerging ICS from 1st of April, really does start to enshrine what we've been trying to deliver for a very long time, in so much as it removes organisational, or should start to remove organisational boundaries and allow us to ensure that the workforce is able to deliver across the organisational boundaries. And we're absolutely here to again spot those opportunities and make that happen, and hence why I'm really excited about what the future holds for North Lincolnshire and the NHS, working with our local authority partners going forward. And I would now like to hand over to my colleagues, Dr. Satpal Shekhawat, our Medical Director, and Helen Davis, our Interim Director of Nursing and Quality, and they're going to take us through the work that's been undertaken on the vaccination programme.
Good evening, everyone. I'm Dr. Satpal Shekhawat. I'm Medical Director for North Lincolnshire CCG.
Good evening. I'm Helen Davis, and I'm the Interim Director of Nursing and Quality.
We're going to talk about the vaccination programme and how Northlinks CCG supported the vaccination programme for our area. So going back last year, when we were facing the challenges with the COVID pandemic, the first hope or light at the end of the tunnel was when we got the COVID-19 vaccine, the Pfizer-BioNTech vaccine, which was approved by MHRA. The approval was granted on 2nd of December 2020. And then closely followed by that, the Oxford AstraZeneca vaccine was approved by MHRA on 30th of December 2020. Now, we all knew that vaccination and successful vaccination program would be the way out of this pandemic and also in saving lives. But it involved huge amount of planning, coordination, because there were thousands of patients who would require vaccination. And there were challenges posed by these vaccines because they were not the most easiest to transport, and they all had an expiry time. And on top of that, we had to prioritize how we would deliver this to which category. Now, we followed the national guidelines, so the Joint Committee of Vaccination and Immunization team had decided to protect the most vulnerable first. So we started our vaccination program by inviting our elderly patients, and alongside with that, we supported the healthcare and social care staff. The first thing we did was we launched a mass immunization program from Iron Store Centre in Scunthorpe, which started the vaccination program on 15th of December 2020. We had lots of people who came out for the first time after a long period of lockdown, received vaccination. We heard some amazing stories from them as we interacted with them. And one of the such couples was Mary and Harry Williams, who were celebrating their 70th wedding anniversary that year. We also got lots of thank yous and gratitude from people because they all felt the importance and the significance of this vaccination, getting that immunity for them so they could meet their loved ones, their families, and come out of the lockdown. The vaccines were comprised in a box of 975 doses, and this was the Pfizer vaccine, which had to be delivered at Iron Store Centre. The vaccines could not be moved further. They required very close planning, purely because the expiry was within 3 days, and that meant that we had to be on top of things, of inviting patients, coming on time to reduce any wastage. Each vaccine was very important, and they were in very scarce quantity, so we had to be very meticulous in our organization. And every member of our team, including from the reception staff to the GPs who were giving the vaccines, to healthcare assistants who were recording the data on the computer system, our IT teams, CCG team, everyone was heavily involved in making this process work. The biggest part played was by our volunteers who worked in that difficult time. As I said, it was December, it was harsh winter, we had snowfall, we had cold weather, but we were very well supported by our local volunteer group. Alongside that, the GP networks played a massive part in the vaccination. So we would like to offer a huge thank you to all our 4 primary care networks, which have worked tirelessly and are continuing to work now as they're delivering both flu vaccination and COVID booster vaccination program. But they were working in a coordinated fashion, following the latest guidelines, and they worked incredibly hard during those challenging times, alongside keeping the general practice open. Apart from the vaccination centres, our practice teams also were working closely with care homes, because we had to vaccinate the residents, the staff. We had to vaccinate thousands of frontline hospital staff we are also very thankful for them, because they were working incredibly hard in ICUs and supporting our patients who were more ill and required hospital support. During the vaccination program, again, the volunteers came handy, especially when we were reaching out to care homes, because they helped us in coordinating work with the clinical staff. Towards the earlier 19th sort of March 2021, Scunthorpe Vaccination Centre, which was the mass vaccination site which opened up in Baths Hall, that was a crucial step for our vaccination program, purely because the capacity to deliver vaccines was much higher there. This vaccination program was managed by our GP Federation, the Safe Care Network, and it was a great example of collaborative work, because all the organizations, which was our CCG itself, Federation, the local council, volunteer services, MPs, local hospital, everyone played a part in setting up the service and also for delivery of this successful vaccination program there. The design of this site was to support up to 1,000 vaccination a day. Anyone eligible within 45-mile radius of Scunthorpe was eligible to book online and come in for vaccination. Now that Baths Hall has reopened as the theatre, we have relocated this site at Iron Store Centre from August 2021. This mass vaccination site was a huge success, and it delivered a large number of vaccination. And so far now they have delivered more than 60,000 vaccines, which have played a crucial part in us fighting this pandemic. So at the end, I would just like to offer my special thanks to the volunteers. As I mentioned earlier, they worked really hard, especially in all weathers. They've supported our vaccination program, and without them, the success of this program wouldn't have been possible. I would now hand over to Helen.
Thank you. So you've just heard about the great rollout of our vaccination programme across our primary care networks and within the Scunthorpe Vaccination Centre. But we didn't want to stop there. We were really keen that we ensured our vaccine programme was accessible as possible for as many people as possible. So with that in mind, we embarked on our most extensive outreach programme. This included us setting up dozens and dozens of pop-up vaccination sessions across a variety of settings and locations all across North Lincolnshire. So we went out to community centres and hubs, we went into leisure centres, and we even attended some community fun days throughout the summer holidays. This has enabled us to take the vaccine out into the heart of our community and ensure that as many people as possible could come forward and receive that vaccine in a place that was accessible to them, at a time that was convenient, and without having to pre-book, as walk-in opportunities were available in all of these areas. Additional to that, we also worked with some workplaces and local businesses where we knew that they might have some difficulties in their employees in accessing the vaccine, so we actually took it into their workplace and enabled them to be vaccinated whilst on duty at work, and this was a great success. We didn't want to stop there, and whilst we were increasing the accessibility of the vaccine, we also wanted to increase confidence in the vaccine. So I'm sure many of you this evening will resonate with the fact that there's been a lot of misinformation circulating regarding the vaccine, particularly in the early stages of the rollout. So what we decided to do in North Lincolnshire was distribute many thousands of leaflets where we could give clear, concise information to people so they could make an informed decision about the vaccine. But what we also did was understand and acknowledge our very diverse communities that we have in North Lincolnshire. So we ensured that these leaflets were not only in English but also in various other languages so that people could access the vaccine and understand the information in their first language. We were also really inspired when some local faith leaders reached out to us and offered us the opportunity of going into some of their faith settings in order to hold some pop-up clinics. We went into a local mosque and a local temple, to name but just a few. And again, these were really well received across the entire community. We didn't want to miss anybody though. So we were really keen that we worked with our local authority colleagues and we ensured that we provided the opportunity for our homeless population to also access the vaccine in specific locations with specific clinics set up for them. And it really was heartwarming to hear some of the stories of those individuals when we took the vaccine to them. Without doing all of this, I'm sure we wouldn't have seen as many people come forward for the vaccine. We heard lots of different stories throughout this whole vaccine programme where people really have said to us, I wouldn't have gone to a normal traditional health setting for this vaccine, and only because you brought it out into our community and really engaged with us have we come forward for the vaccination programme. And this is something that we want to hold on to as we move forward with our wider health outcomes. So more recently, we've now been working on our younger cohorts. So you'll all be aware that back in August, 16 and 17-year-olds were added to the COVID vaccination programme. And in addition to that, as of this week, 12 to 15-year-olds across the school settings have also been included within the vaccination programme. And that's been delivered by our school immunisation teams. As you can see from the slide there, that 60% of our 16 and 17-year-olds have already come forward for the vaccination. And in line with our outreach programme, we're continuing to offer this across colleges and sixth forms to increase the uptake of the vaccine programme. You can see from the slide there that we've had some real key successes with everything that we've done. And I'm really proud to say that more than 90% of our frontline healthcare workers and everybody aged over 50 have had both vaccine doses so far. We've also had some great successes in many of the other age cohorts across the vaccine programme, and we will continue to do everything we possibly can to offer the vaccine at a most appropriate location for people to come forward. So there's still time to get your vaccine if you haven't done so already. And I know my other colleagues this evening have already spoken about this, but please, we would reiterate that message. We will continue to call what we our evergreen vaccination service. So that means that if you haven't had the vaccine so far, for whatever reason that may be, but you now want to have it, you can come forward. You can book online through the national booking system, or if you follow us on our social media pages, on our Facebook or our Twitter page, we always publicise where we're going with our outreach clinics, and therefore you don't need to book, but you can just walk in. Of course, there's also the start of our booster programme as well. So please be aware when you get your message, do come forward for that booster jab as and when you become eligible, which is 6 months after your second vaccination. And can I just end this by saying a huge thank you to all of our partners. This vaccination programme and the huge success that we've had would not have been possible if we were doing this in isolation. There are too many to name, but local authority colleagues, our primary care colleagues, our Safe Care GP Federation, CCG staff, all across the board, and especially our volunteers have been absolutely instrumental in ensuring the huge success of this vaccine programme. So I'm delighted now to be able to show you the video of our highlights of our 2020-21.
Over the past year, North Lincolnshire CCG has been working hard to improve local NHS services. Here are a few of our highlights from this year. It's been a year like no other. Since the first coronavirus case in our hospitals in March 2020, NHS staff have cared for thousands of seriously ill COVID patients. At the same time, the NHS has rolled out the biggest vaccination programme in our history. Throughout the hard times, the amazing work of our NHS staff, volunteers, care staff and many other key workers has really shone through. Their work has been truly incredible.
It now feels like there are much brighter times ahead for our country, but we'll always remember those who've sadly passed away due to coronavirus, and our thoughts are with their loved ones. The dedication, bravery and tireless commitment of our NHS staff has also meant that many thousands of lives have been saved.
The NHS could not have done all of this without the skill and dedication of our people, and the support of the thousands of volunteers, returners and other key workers who have all been instrumental throughout the whole pandemic.
In December 2020, following a difficult year of restrictions, the NHS began rolling out the coronavirus vaccine.
Slowly they came, some in wheelchairs, some on foot. Thousands of 80 and 90-year-olds, all with one aim, the vaccine.
It's going to make a lot of difference because I haven't been out for weeks.
While most seem to take it in their stride, like Harry and Mary Williams, who were celebrating their 70th wedding anniversary.
In a lot of ways, very excited.
All eagerly waiting for this, the entire team, and the minute I got it, I made sure everything was okay. I was a bit shaky, and I informed all my team that we had arrived, the vaccines had arrived, and we were very excited.
Across England, GPs had raised concerns over a lower uptake of coronavirus vaccinations among patients from ethnic minority backgrounds, warning that misinformation had left some patients reluctant to come forward. Local health and care organisations across our area came together to target specific communities, religious groups and distribute vaccine information in several different languages.
मेरा नाम सतपाल सिंह है।
इस वैक्सीन में कोई भी पशु का अंश
कि ये वैक्सीन्स बहुत सेफ ने ते बहुत वधिया ने।
Many languages, but one message.
Efektywną I bezpieczną.
करती हूँ और मुझे कोरोना वायरस की वैक्सीन
Videos by doctors in Gujarati, Urdu, Punjabi, Polish, Hindi and English, telling people to trust the scientists when they say COVID vaccines are safe. Pounding the pavements in Scunthorpe's town ward, where almost a fifth of people entitled to the jab still haven't taken up the offer. So leaflets in 4 languages are being delivered. And medical staff are persuading people to make appointments.
A lot of the areas around here, people work in different jobs. There's deprivation factor, so the hours are antisocial. They're difficult to find time to go and have clinics. Just making them aware that there are clinics running outside work hours, on weekends, and all that will improve the uptake.
Yeah, well, there's been a load of rumours on internet, hasn't there?
And I think that's what we're trying to battle against, that there's a lot of misinformation.
And this is one way they're tackling that. It's the latest idea following others like a pop-up vaccine centre at Scunthorpe's Sikh complex and another at one of the town's mosques.
We wanted to have a conversation on a Friday prayer, so the doctors came in, they did like an awareness session. We stemmed like a really good interest, so we thought we'll have a clinic.
I have to go out all the time, I have to meet my colleagues, and yeah, I've got a little one in my home, so yeah, I have to protect her.
This is for my protection and for the people or my family protection.
Here at this food processing site, they're making sure everyone has access to the vaccine.
We've got a large Eastern European migrant workforce. Some of our workers, we know that they don't have GPs, and therefore we felt a corporate responsibility, not just for our workers here, but also for the local community, to make sure that people are being vaccinated.
And translators are on hand to help anyone that needs it.
In March, alongside North Lincolnshire Council and our GP Federation Safecare Network, we launched North Lincolnshire's COVID vaccination site at the Baths Hall in Scunthorpe.
We're here at the Baths Hall in Scunthorpe. We are really excited to be here on launch day. I wanted to say a huge thank you to all of the volunteers, our GP colleagues, but thank you also to all of the staff, the nurses, the pharmacists, the admin staff. We have the army here at the moment. Thank you to everybody to make this possible today.
In November 2020, our CCG was rated good under NHS England and NHS Improvements NHS Oversight Framework for 2019-20. Together, our CCG staff, local health professionals and partners always strive to do the best for our population by developing local health and care services. We all know that this year has been particularly challenging due to the ongoing effects of the pandemic. This excellent feedback that we have received from NHS England and Improvement is testament to the hard work, commitment and collaborative working of staff and key partners in North Lincolnshire. I would like to say a huge thank you to everyone involved. This is a fantastic achievement.
In November 2020, details of our electronic palliative care system were shared nationally as best practice.
Patients at the end of their life are looked after by many different teams. All these different teams use different computer programs, and thus there has always traditionally been an issue with regards to providing continuity of care with continuity of information from one organisation to another. We introduced the electronic patient care and coordination system. This clever piece of technology allows a single point of access so that patients who are at the end of their life can ensure that their preferences are continued throughout all the different organisations that provide them care. These preferences include patients' wishes for place of care, place of death, whether they want to be resuscitated, and who their carers are, so that their wishes are respected. This innovative IT solution has been recognised as best practice and has been published nationally as an NHS blueprint so that we can share our experience with the rest of the country. It ensures that the patient's preferences are respected, it offers support to the patients, the carers, and ensures continuity of all the carers involved in the patient's care, something that up till now was not possible.
The pandemic has presented an exceptionally challenging time for us all. The effects of social distancing, lockdown, and the loss of loved ones can all take a huge toll on our mental health and well-being. We have been working alongside local mental health providers and charities to ensure our population has access to the right support. A free online mental health and emotional well-being support service was launched to help children and young people living in North Lincolnshire. People aged between 11 and 25 can register to use Cooth, an anonymous online counselling and emotional well-being support service which can be accessed using a computer, smartphone or tablet device. Through Cooth, children and young people can register to receive one-on-one online sessions with qualified counsellors, receive and provide peer-to-peer support through moderated online forums, and read and contribute to articles. Alongside the mental health charity Mind, we launched The Haven, an initiative to provide late-night support and safety for people with mental health problems in Scunthorpe. Lung patients in North Lincolnshire were the first in the UK to benefit from a pioneering virtual reality pulmonary rehabilitation programme. The programme was named a finalist in this year's HSJ Value Awards in the Respiratory Care Initiative of the Year category, as well as winning the regional award at this year's NHS Parliamentary Awards. For more information about your local NHS, please visit www.northlincolnshireccg.nhs.uk.
My name's Erica Stoddart and I'm the lay member for governance and vice chair at North Links CCG, and I will be hosting the question and answer session. I'd like to thank our panel for their presentations, but some of them will be back soon to actually answer the questions. So the first question is, Hospital COVID admissions are rising across the country and we still have winter to come. Does this mean the vaccine isn't working, or are all of these people in hospital unvaccinated? And I'm going to ask Satpal to answer the first question.
Thank you for the question, Erica. So there is some good news. We have started to see some decline in numbers for hospital admissions from last few days. However, the numbers were rising earlier. And there has been some research done on this through the national immunization studies. So in the beginning half, from December 2020 till July 2021, 84% of the admissions which were happening were of unvaccinated people. But during this program, during this time, we had an immensely successful vaccination program. So we have got 90% of our population who've had their vaccination, at least their first dose. And hence what it means now is that people who are getting admitted now since July onwards, a large proportion of them are vaccinated individuals. But it doesn't mean that the vaccine isn't working. It just means that these individuals are still catching COVID. But what we also know from the studies is that the severity of these infections is minimal. The mortality rate, the death rate, is less than 0.5% for people who have been doubly vaccinated, which is excellent news for us. But what it also means is that the vaccine is not as successful in stopping transmission or catching infection, which was always the case. The vaccine's there to protect us through immune system, to reduce the severity of the disease, for which it is working. It does pose a challenge for us for the winters because if the number of bed occupancy is high, it would affect delivery of care for other sort of services. So we still need to do what we need to do, which is hand washing, social distancing, taking up all the vaccinations. So flu vaccination becomes even more important this winter. Alongside with that, the COVID booster vaccination will be important. So the appeal to everyone would be that please continue the practicing of social distancing, hand washing, wearing masks where possible, and go for your vaccination when you're invited. Thank you.
Thank you, Satpal. Our second question is from Jeffrey in Scunthorpe. Thank you, Jeffrey, for sending this in. Is there a requirement for GPs to resume face-to-face consultations in the near future? And I'm going to ask Faisal, our chair, to answer this question.
Thank you, Erica, and thank you very much, Jeffrey, for the question. Earlier on in the AGM, I mentioned some general practice activity figures. So in June this year, we've had approximately 95,000 general practice appointments across North Lincolnshire, and nearly 70% of those appointments have been face-to-face. So there is a significant amount of face-to-face activity taking place within North Lincolnshire. In terms of what I suspect is the wider sentiment around the question, I'm assuming there's something there about the difficulty some people are having getting general practice appointments, and probably something in there about virtual appointments and their rise over the pandemic period as well. So just a few points I'd like to make, really, Jeffrey, if I may. I think it's important to be clear that we are really struggling with demand in general practice. The teams are working flat out non-stop, and we're consulting more patients, as I said, than two years ago. Add on top of that general practice teams have spearheaded the hugely successful vaccination program. You can imagine the amount of work that's gone in and is still going in. So I think it's fair to say that there is, some real issue there in terms of the demand and how we cope, but we're working together on how we deal with that. A few other points might like to make. I think there's something about what's happened at the outset of the pandemic in terms of infection prevention and control. We know coronavirus spreads through contact between people. Now, in waiting rooms, in general practice surgeries, if we have people sitting next to each other in close proximity with coronavirus symptoms or other symptoms, we would have had huge spread in those areas. And we need to remember a significant number of vulnerable people come into our general practice surgeries, people who may be elderly or with lots of medical conditions who are highly susceptible to some of the serious effects of coronavirus. So it's important to protect people, and that's why the physical environment looks different to years gone by. I'm often asked about why so much information is sought from patients before an appointment is given, whether that be the reception team or a doctor ringing first to find out a bit more. And that's really important, and because we want people to go to the right professional first time round. And we can only do that if we have some of the information first. So, as I've mentioned, appointments there's a huge amount of demand. We want to make sure appointments are given out in a correct way. So, for example, if somebody books a face-to-face appointment with me because of a problem with the prescription, actually, it may be, if I had that information beforehand, one of our pharmacists could have rang the patient and have sorted out that issue on the telephone, and saving a face-to-face appointment for someone who needed to be seen face-to-face. So the intention behind seeking that information is a really noble and genuine one, and it's not about reception staff or people being nosy. It's really about working out how we direct people to the best place. In terms of face-to-face appointments, I think it's really important. I need to be really clear about this, where a face-to-face appointment is clinically indicated. So, for example, let's say I need to listen to someone's chest, and I can't do that virtually, although interestingly, that's being worked on in terms of virtual stethoscopes. But for now, I don't really have any other option apart from seeing someone face-to-face. And if someone can't access digital means, again, a face-to-face appointment is exactly what should happen. But saying that, there are a huge number of instances where a telephone, video or online consultation can be of benefit, especially to our patients who don't necessarily need to leave the house. So, for example, I was working in the GP out-of-hours service on Sunday, and I had someone who was very well, no problems apart from a rash. Now, that's something I had a look on the video at, and there was nothing to worry about, and all the appropriate safety netting and so on took place. But that saved someone a trip across North Lincolnshire, which is 325 square miles in radius, and they were very grateful. So virtual consultations do have their benefits, and they are part of the NHS long-term plan. I'd also like to take this opportunity just to mention 111 and our pharmacies for minor conditions. They can be really helpful and useful, so people shouldn't forget those. And I'll just finish by saying, look, this is a really difficult time for our general practice teams. We understand, people, it's taking them a while to get through on the phones. We understand appointment times, can be long. We are trying our best. Everyone's trying their best. So please just be patient with us. And hopefully, as the government works to address some of the workforce shortages and things change and we come out of the pandemic, things will start looking a lot brighter. So that's a long answer to your question, Jeffrey, but I hope that's been helpful. Thank you.
Thank you, Faisal. Our next question is, we hear that elective care procedures are being cancelled in other parts of the country again as we head into winter. How bad are the pressures in North Lincolnshire? And I'll hand this over to Alex to answer.
Thank you very much for that question. At the start of the pandemic, to make sure that the capacity was available to support the most critically ill of our patients, some of the non-urgent planned operations were stepped down, and this has resulted in an increase in waiting lists and waiting times for individuals as well. This year we started a recovery programme across the NHS, and that's happening locally to make sure that we can try and catch up on those waiting lists and make sure that we can see people as quickly as we can. And hospitals are a key part of that recovery programme. So that's our local hospital, but also the independent sector who've been supporting this as well. I'm pleased to say that our local trust has managed the plans around their recovery really well, and despite the pressures in accident and emergency, haven't had to stand down any elective activity, so that's planned activity as well. So that's a really positive thing to see as well. Just in terms of providing reassurance that people are being kept safe on waiting lists, there's regular clinical prioritisation undertaken of those waiting lists. Those people who need to be seen most urgently, so those people with cancer, those people who need to be seen within a month, and some of our longest waiters are prioritised to make sure that they're seen and continue to be supported throughout the pandemic. Other people who are having to wait longer on the waiting lists are regularly seen, their cases are seen by clinicians to make sure that they're kept safe on our waiting list as well, and that their care is supported, even if they have to wait longer to be seen as well. Okay, thank you.
Thank you, Alex. Okay, and the next question is, the vaccination uptake figures in our area have highlighted concerns about health inequalities and that there seems to be better engagement with some communities than others. What is the CCG doing to address this? And I'll hand this over to Helen to answer this question.
Thank you very much, Erica. A really important question. So you're absolutely right. We are committed to reducing health inequalities, and not just for our COVID vaccination programme, but for all of our health outcomes. But the vaccination programme has really helped us to connect with our local communities and engage with them in a much more meaningful way, but whilst recognising there's an awful lot more work we want to do in this area. So our outreach programme for the COVID vaccine has really been instrumental in this, and we've been utilising our data to really understand where there is differences in uptake of the vaccine, as an example, and what we might need to do differently in those areas. And as I touched on earlier in the presentation, we've spent a lot of time going out into these communities, engaging with people, trying to gather feedback and information to understand what it is that we need to do differently as we're delivering our healthcare services, and thinking about this for the future as well. So as we go forward, we'll be continuing to really connect with all of the different communities, building on all the great work and those networks that we've really established throughout this last 18 months as we've been in this COVID pandemic. And absolutely part of this will be that partnership approach as well. Nothing that we can do in isolation and on our own. So this is about all coming together, using the full data, intelligence, engagement opportunities that we have, and really reaching out into our communities, hearing the people's voice, so truly listening to people, truly gathering that feedback and thinking about how can we use this to connect with people and to deliver our healthcare services in a different way to reduce those inequalities as we go forward. Thank you.
Thank you, Helen. And question 5. Scunthorpe A&E is so busy nearly all of the time. How will people who need to be seen be seen? And I'll hand this over to Alex to answer this question.
Thank you very much for this question. Our hospital, accident and emergency departments have indeed been very busy throughout the pandemic period and continue to be very busy as well. We are, again, I'd like to take this opportunity to encourage people to make sure that they do use NHS 111, to make sure that they can be directed to the right services as well. We have looked at some of the things that are driving the business through A&E, and sometimes people are going to accident and emergency who could otherwise be dealt with elsewhere in the system. So I would very much encourage people to do that, to use primary care and to use local pharmacists as well. It's very challenging for our accident and emergency departments as well. We have seen an increase in activity going through our departments. We've also seen some more complex people going through the departments as well. Again, just to reassure, as people go through the department, they are streamed to make sure that those people who need urgent and immediate support are appropriately dealt with as well. But certainly encourage people to make sure that they are using those services responsibly to be able to support that as well. It is also more challenging within the accident and emergency environment as well, because, as colleagues have mentioned, social distancing means that space within the department is constrained as well. So it's a more challenging environment for people to be able to support that. But again, to provide reassurance, people are constantly being prioritised and supported within the department and kept safe through their journey as well. Thank you.
Thank you, Alex. And our final question. If last year is anything to go by, this winter could be worse with flu coming back stronger. What are the chances of a new variant emerging, and what are the plans regarding booster jabs? And I'll hand this over to Helen to answer this question.
Thank you, Erica. So I'm going to start by just mentioning the flu vaccination programme. So we've talked an awful lot this evening about our COVID vaccination programme, but again, I just want to highlight the importance of coming forward for your flu vaccination programme as and when we've commenced that in the recent weeks here in North Lincolnshire. So I do urge each of you to come forward. It will not be any more critical than it is this winter. We've already heard of lots of pressures across the entire system, so that's what you can do to do your bit to support the system going forward. So in terms of new variants emerging, this is always going to be a concern of everybody's as we move into the winter months. So the things that we can do to try and prevent this is our good infection prevention and control measures. So what we can all do is ensure social distancing whenever possible, ensure wherever we can meet up with people outside and reduce our mixing indoors. And if we are meeting indoors, and it's particularly important as we move into winter and the colder months, we ensure really good ventilation. So it might not seem logical to need to open your windows in those winter months, but actually that will help to reduce the transmission of the COVID disease. But also what that will do is if we can bring down our COVID vaccination rates, that will reduce the risk of new variants emerging. So that would be my plea to you this evening. I did briefly mention earlier that we've commenced our booster vaccination programme for the COVID vaccine. This is going to be available for anybody who's aged 50 and over, for health and social care workers, as well as people who are immunosuppressed, or if you're living in a household with somebody who's immunosuppressed. You'll be able to have your booster vaccine once you are 6 months or 180 days post your second dose of the vaccine that you've already had. The vaccine on offer for the booster is first and foremost is Pfizer, and if you can't have Pfizer, then it will be the Moderna vaccine. That will be the second offer. You will be contacted when you are eligible, either via your primary care network or via the national booking system. So again, once you receive that information through that you are eligible, then please do go ahead and book via one of those means that I've referred to this evening. Thank you.
Thank you, Helen. So, as we said, that is the end of our question and answer session. However, if you have any further questions following this afternoon's event, then please email us at the URL there, or call us on 01652 251000, or you can go to our website and it will be there as well. So I'm now going to hand over to Dr. Faisal Beg, our chair, who will close the session today. Thank you very much.
Okay, as I said earlier, everyone, this is likely to be the last AGM our CCG holds. So I'd really just like to take this opportunity to say a big thank you to everyone who works within North Lincolnshire's NHS or works with North Lincolnshire's NHS. It's been a real team effort during the pandemic, and the vaccination programme, clearly demonstrates how working together can see us through difficult times. So we just need to keep on building on that. And my final plea to you all would be, as I said earlier, it's a really difficult time for our workforce. Please be patient with them. Please support them, because they are the NHS. I'm now going to hand over to Emma Latimer, who's our accountable officer, to say a few words. And I'd just really like to take this opportunity to thank Emma and also Alex Seal for the leadership they've shown in turning this CCG around and bringing us to a better place. So over to you, Emma.
So thank you very much, Dr. Beg. I'd just like to end with some final remarks. First of all, to say thank you to you for your fantastic clinical leadership throughout the last 3 years that I've worked alongside you. Also, your fantastic efforts in the pandemic, leading the way, not just for our CCG, but actually for other leaders, not just in North Lincolnshire, but across the Humber and beyond. You've been fabulous. I've seen quite a lot of you on my TV screen every night, and it's been wonderful. But the messages, the public responsibility and accountability you've taken has been fabulous. So look forward to carry on working with you in the new system. Also, To Alex, is the Chief Operating Officer and has led the CCG over the last 18 months, really again dealing with everything in the pandemic. To all of the directors, some of whom you saw today, who've done a fantastic, brilliant job. For the non-exec directors, who have challenged and supported me in equal measures over the last few years and really kept us focused on what we need to be doing. Their expertise has been fantastic, so thank you. To my wonderful team, every single member of which has just been great, has really worked hard through some really challenging periods. To all of our partners, to our voluntary sector, to our local authority, and to you, the public, for bearing with us and helping us deal with this pandemic in such an amazing way. I'd also like to pay tribute to my communications and engagement team, who again have helped us prepare for today, and hopefully has given you a real rich sense of what we stand for, what we're about, and how we're really going to put your needs and interests at the forefront of everything we do as we move forward into the ICS. So thank you everyone for tuning in. I hope I haven't forgotten to thank somebody. I'm sure I probably have, but the PCN directors, should have thanked them first in terms of the COVID delivery. Thank you to everybody. We truly, truly mean that from the bottom of my heart. So thank you, and I hope you have a nice evening. Thank you.